Let's talk about doing group therapy and especially for substance use treatment through telehealth.
Oof.
So, how to conduct those group therapy sessions virtually. To discuss this, I am so glad to have with us Dr. Malcom Horn. She received her doctorate in psychology with a teaching emphasis from Walden University. She is a licensed clinical social worker and is licensed by the state of Montana as an addiction counselor. She also had accreditation from NADAC as a master's level addiction counselor and a substance abuse professional. She currently works as the director of mental health services for Rimrock Foundation. She's responsible for ongoing training and education for clinical and support staff and supervises the mental health counseling team. So, Dr. Horn, thanks a lot for being here with us.
Thank you for having me. I appreciate it.
Yeah. So there is so much to consider when providing group therapy in the virtual environment, and specifically for substance use disorder treatment, IOP programs, etc. So you've been there, done that a lot.
Yeah.
So can
Bought
you
the t-shirt and all the things.
Yeah. So can you help us understand what does that look like? What should we
Yeah.
be thinking about? What we should look out for?
Absolutely. It's such a good thing to talk about because we know that when it comes to substance use treatment, evidence-based care is going to be through group. We know that group therapy gets you a better outcome than individual therapy when it comes to substance use disorder. So then, of course, when COVID-19 happened, we had to get really good, really fast at providing that care over a camera. So one of the first things I would say is making sure you have good technology. It's hard to engage in a group over a tele, and then if they can't hear you or they can't see you well, that just makes it even worse. And I can understand that. I think we've probably all gone to some type of webinar or something where it's hard to hear, it's hard to see, and you don't want to pay attention, you don't want to engage. And so it's the same with our patients. So spending the little bit of extra money to get the quality microphone, the quality camera, very important to do that. So that's the first thing. Then let's assume you have that in place. Then it's how do you keep them engaged? And so that can be a big challenge. How do you keep 10 people on the Zoom call or the whatever platform you use engaged? And so there's different strategies that you can use to do that. But that's, technology is the first thing. Second thing is how do you keep all those little nuances in play? Do you want me to tell you all about those little things?
Yeah, that would be great.
Awesome. So one of the things is how do you make sure that they are participating? I think we've all probably gone to a webinar or some type of meeting or training that's on a camera and you think, oh, good, I can clean up my email while we're doing this or whatever. So you want to make sure that the patients are front loaded with the expectation that they will be engaged. I know that I've gone to webinars where the trainer says, this is a webinar, you need to be engaged. You have to have your webcam on. I'm going to ask you questions. You need to interact through the chat box. Ways that we make sure that people in trainings are engaged. Same with patients. How are you going to keep them engaged? Are you going to deliberately call on them? I know when I do group supervision, I say we're going to go around the blob because you have everybody up there on the screens.
Around
I
the
say,
blob.
Yep, going to go
like
around
that.
the blob. So it's not really a circle, it's a blob.
Yeah.
So we're going to go around the blob. And so they know that, okay, I'm going to be called on. I'm going to have to answer this question. I'm going to have to give feedback. And so it should be the same with your group therapy, making sure that they know, okay, we're going to go around the blob and you're going to have to give feedback about this. And so making sure that they know that that's the expectation. Webcams should be on at all times. I remember we had one gal who wouldn't turn her webcam on during an IOP group. Come to find out she was actually in Walmart shopping during group. So,
oh no.
Oh, I know. So that's something, and I don't think I could bill Blue Cross Blue Shield or Medicaid while a patient is grocery shopping, so I can't do it, right? So, so front loading that expectation with the patient it's just like you're in my office, you're going to be present, engaged, actively participating. So you call on them, make sure the webcam is on. What we've also found It's really important that outside a group, we keep them engaged. So we've stepped up how many times our peer support team reach out to them. We have a fabulous platform called GOMO, where we can chat live with the patient. They get messages that say, are you doing your 12-step meeting today? It reminds them about homework. It can remind them about their group session and what task work might be presented. So we've had to work also outside of the group session to keep people engaged and interactive. For a while there, we also increased the number of individual sessions. Normally they would get like one a week. So we upped that temporarily, particularly when COVID was really bad. It was really hard on a lot of our patients. I mean, everyone struggled with COVID. And then again, you take the substance use population that may have not a good stable support, not good coping skills to begin with. And then you throw in the stressors of a global pandemic. And we just needed to up our game a little bit and really interact more with our patients and remind them that we were there for them.
Yeah. And I've heard that makes a huge difference.
Yes,
and it gives them a sense that their provider cares about them.
Absolutely. Yeah. And they can email you. I mean, we had several patients that would just email us every day. And they knew that if I have to check in via email every day, that was helpful for them to kind of stay on task. And so, I mean, technology was a great way to really up that game for people.
And do you have a co-facilitator to kind of help if someone goes off screen or if something comes up? Or
not formally, although we are really, we're a pretty integrated treatment team. And so we also know, okay, if one person leaves my group, I know I can say, okay, hold on group just a minute. I noticed that Ray left. I'm going to send a quick message to peer support, and they can send the message to peer support, and peer support can then go track that person down. And so doing things like that, I would love to have co-facilitation, but it's just really hard to do that with a workforce that is struggling to begin with. So we got creative and said, all right, if that type of thing happens, we're going to make sure that we have other members of our treatment team that can follow up with that patient.
Yeah. And what about addressing like behavioral or environmental issues on the client's end? Do you try to do it privately? Do you bring it up in the group and like not have the elephant in the room? Or do you how do you handle those things?
Well, very similar to if they're live, if they're in group with you, everyone is sitting in the same room and there's an issue. If it's something that you would call out in front of that group, then go ahead and say it in front of the group. Or if it's something that you would do privately, you might give the group a break. Say, hey, we're going to take a 10-minute break. Everyone take 10 minutes. And then, hey, during that 10 minutes, Ray, could you stay on for just a minute so I can touch base with you? And so you can do it that way. So it's really, would you do it in your office? Then okay. If you wouldn't, then okay, there's your answer. So it's really just doing the same type of thing, just with a camera. If it's important, I call them out in the group. If it's something that can wait, we'll do it later.
Yeah, excellent. And then in terms of the group formation, I know sometimes organizations still have like a one-on-one video meeting with the client first to make sure that they're actually going to be appropriate for a video group meeting. Like they have the environment, it's not too distracting, etc. Yep. Do you guys do that? Is there like an onboarding process or vetting process?
Yeah, absolutely. So usually it's part of their transition plan. So if they're coming from one of the higher levels of care, then there's going to be usually with their care coordinator that's going to say, okay, we're going to set you up for IOP. This is the process. And then we try to have that IOP counselor meet with the patient before their first group. Doesn't always happen, but that's really what we try to strive for. If they're not coming from a different level of care, if they're brand new to us, then they get the standard new patient orientation for that program. And individually, absolutely, we'll do that. Send them the forms. They can ask whatever questions they may have. And so we try to do that. And so, yeah, because otherwise they don't know. You have to say, this is the expectation of group. You will be participatory. And how do you let us know if you can't participate that day? One of the things that did happen, some of our patients live in a very rural community where they didn't have a strong internet connection. So participating in a group that way was really hard. And so there were some patients that we had to adjust the treatment plan and the expectation where maybe even though we think they need to do group, it's not going to be, they can't do it because they don't have the technology to do it. And so then we had to adjust the goals and expectations of the treatment. And that can be hard too, because you want to give patients the care that they actually need.
Yeah. What if they say they can't be on video because, my camera's not working today?
Yeah. So we've had that happen a couple of times where it's like, oh, I just don't know how to use it. And so if we can, sometimes we've had them actually come on site for like let me show you how to do this. And so we've offered that to patients. Usually they're like, oh, well, I can figure it out. It hasn't happened very often though. For the most part, people are like, yeah, I can do that. I would love to do group from my living room. And so then it's making sure that, okay, if you're in your living room, are you the only one there? You want to make sure that your husband or your kid or your dog isn't running around and being distracting. Really telling patients, if you wouldn't do it in my office, don't do it over the camera.
Right. So if they can't be on camera and that's your policy that they have to be, do you have them leave the meeting if they're only on audio and don't have their camera on?
If for whatever reason they can't use a camera, so if they don't, maybe they don't have one because some people didn't have a smart device, they didn't have a webcam. So then if phone is the only way that they can participate, yes, we will do that, but we don't like that. And I don't think that's necessarily the best fit for them because you can't see them, they can't see you. But if it's a one-off, like normally they do, but today they weren't able to for whatever reason, okay, maybe we'll let that slide, but recognizing that's not going to be the best way to do care for them. They need that interaction. They need to be able to see people. You need to be able to see them. That helps us connect. That helps us connect. And we know that it's through that connection that people get better.
Yeah. And how do you guys handle interruptions as a group? So like, let's say someone walks into the space of one of the participants, which would be a privacy issue.
Right.
Yeah.
So we might have to say, oh, pause, who was that? And then making sure that that person has indeed left the room. And then I would want to take a break and then wrap around with that person and say, hey, when your husband just walked through the living room, that was very disconcerting. That wasn't a very kind thing for the rest of the group. What can we do to make sure that doesn't happen again? Would it be better to move to your bedroom or to the basement or someplace else? And again, you have to front load the expectation before they even start. The expectation is you're in a private, confidential place where you can really engage in the therapy. It's really important to be able to and help the patient understand that's a confidentiality thing. How would you feel if you were sharing your stuff and another group member's spouse walked in? You would not like that. And so really making sure they understand the reason behind it, right? We're not just being mean or picky. There's a reason behind it. We want to make sure that it's a safe, confidential space.
Yeah. I've heard some groups the group will use like a code phrase that they will say to let the rest of the group know someone walked into my space.
Oh, that's a great idea.
And then they'll pause the meeting. Because you might not know, like you might not see it, and they might not want to say.
I love that. That's a great idea.
Yeah.
Yeah.
What's been most helpful for you in terms of getting engagement from the group? So you mentioned calling on people. What else has been helpful in terms of engagement?
So calling on people, and I think also making sure that they know that they will have stuff to present. So I've seen this in not just tele, but face-to-face sessions. If a patient's like, oh, I don't have anything to present today, I just get to sit around like a lump. So trying to make sure there's something that everyone needs to participate with every day, whether it is like some type of check-in, whether it's like a check-out at the end of group. I like to train people to say, okay, at the end of group, you need to report back on one thing you learned from group that day. Because then they have to be paying attention, because then at the end of the group, they're going to have to say, hey, I really learned this cool thing about Ray, and I'm glad that I was here today to learn that. That way they know they have to be paying attention during the group. So that's another way to do it as well. We've had too, where we had a couple patients that didn't really have a good internet connection. They didn't have a solid webcam. And we actually found an open office in our main facility, and we two people could come in and sit there. We could set them up on the technology, and then they weren't completely alone. They had a group member sitting there with them. And that was a great thing too, because one of the things that we really found with everything that's happened in the last 2 years is the isolation for people has been really, really hard. And it's been said that connection is the opposite of addiction. So if I can help keep you connected with people, that's going to be one way I'm going to help you do better.
Yeah. Do you ever use breakout rooms where there's not a clinician present in all the breakout rooms, but they go to breakout rooms separately
We have
or something?
not used that. We've had separate different groups. So you have your regular therapy group, and then we have lots of different ancillary groups. And so those ancillary groups are not necessarily part of that main session, but they're a separate group. So in addition to their regular IOP group, they may also have, say, a life skills group or some type of other group. So it's not necessarily a breakout within that group, but it's another group that they get to participate in during that week.
I see.
Yeah.
Yeah. Excellent.
Often with
And
a
I know,
different counselor.
so a lot of the platforms allow chat, and they'll allow private chat.
Yes.
Yeah. You allow the private
Yep.
chat. Yeah. Okay.
Yep, we allow that. We allow them to put the things in there. Usually patients are really good at ratting each other out if someone's inappropriate. So it's usually not that, right? It's usually not that hidden. Although we found if they want to have a private conversation, they usually just text each other on their cell phone.
I see.
But that's another thing to think about when you onboard and prepare people for group, making sure that they know, don't be on your cell phone during the session. You should not be doing that. Just like you wouldn't be doing that in a regular therapy session. You shouldn't be on your cell phone during the group, and making sure that you tell them too, don't record it. People want to maybe record things, and that would also be a confidentiality violation. You don't want to be recording a session with other patients. That's wildly not okay at all.
Yes. Yeah. No kidding.
Yeah.
Yeah. Well, this has been super helpful. Any other tip you'd like to mention for those that are going to be doing groups for SUD treatment?
I don't think so, but just to reach out and get help, get assistance, always learn and grow. We can always be doing better. I learned something this session. So, I mean, we always can learn, how do we do things better? And that's what I want people to keep doing.
Excellent. Thanks a lot, Dr. Horn.
Yep. Thank you. Take care.
Yep.
Bye.
Bye-bye.